is Allison Hartley. I am a student nurse with Nightingale College, and today I am performing the ostomy care video submission. So previous to the video, I had already put on the plate and pouch for my patient, but here we go. So before I would go in, perform some hand hygiene, knock on the door, allow my patient to let me in. And I would come in, close the door and or curtain for privacy, introduce myself. Hi, my name is Allie. I'm going to be your nurse today. What is your name and date of birth? And then I would verify it on their wristband. Today I am going to be providing some ostomy care for your ostomy bag. Is that okay? Yeah? Okay, perfect. I'm going to perform some hand hygiene, put on some clean gloves. And I'm going to take off the bag and empty it into a basin. I would discard it, but for the video, I am going to be reusing it. If I were to discard it, I would keep the clamp if I needed to. I would also take off the plate, making sure I am aware of how I'm taking it off to preserve skin integrity. Pulling out from the corners. And then also for the sake of the video, I'm going to be saving this. And I'm going to take off my gloves, discard hand hygiene, put on some new clean gloves. Okay, next, grab a washcloth and with some warm water and an improved cleanser, I'm going to start cleaning around the stoma. And as I'm doing that, I am looking at the stoma and observing it for skin integrity and how the stoma looks. We're looking for a beefy red stoma. It's moist, it's not protruding out too much, and the skin around it looks healthy and intact. So just cleaning around that. Dry it around. My kit did not come with the measuring guide, but if I did, I would measure it and then put it up to my plate, mark it where I want to cut it, cut out my hole, I want to prep the skin with protective skin prep. I don't have that in my kit either, so this is just me pretending, letting it completely dry before attaching it. I am going to attach my ring, or my plate, excuse me, making sure it is completely flat and sealed all the way around. It is nice and not too tight around the stoma, but it doesn't leave too much space either to where if there's any fluids that come out, it's not going to be affecting the skin integrity too much. I'm going to take the bag, listen for those clicks. Perfect. That means it's nice and on. And if it's not clamped, I'm going to make sure it is by folding it up around a few times and closing this clamp. So it's closed, it's on. I'm going to reposition my patient into a comfortable position. Are you comfortable? Do you have any questions for me? Okay, perfect. Here is your call light. If you need anything, don't be afraid to call us. I'm going to discard my gloves, perform hand hygiene, and then I'm going to exit the room, closing the door and or curtain behind me, and document the procedure that I have performed.